So how do you know if your child has worms? Well, basically, worms is one of the common causes of why children might complain of having an itchy anus, or they might have an itchy vagina, or they might complain of pain when they're passing stools, as well as pain in the vagina, or even lower abdominal pain. Your child might also feel hungry all the time. However, they might also complain of pain when passing urine. So in some cases, we usually do a urine sample just to make sure that they haven't got a urine infection, and we will usually do a trial of deworming. Now, a trial of deworming means giving them what we call medications such as ovex or Vermox or Mebendazole, which is a generic name. So for a child, for example, the age of 5, we would usually give 5 ml to be taken today, and we would normally advise 5 ml to be taken in 2 weeks. And the reason why you should take 5 ml again in 2 weeks' time, which is repeating the treatment, will be that in some cases, anti-worm treatment might not be sufficient to kill the worm the first round. And that's because, if you remember, the eggs can remain in the bowel. And what the worm treatment can do is it can kill the worms, but does not kill the eggs in the bowel. So usually the eggs will hatch again in about 2 weeks' time. So therefore, when the eggs hatch again, then you give the worm treatment to kill the eggs. And that is why some of us would say, oh, I've given the worm treatment and it's not worked. It's not that it's not working, it's just that the worm treatment does not kill the eggs, so the eggs will tend to hatch again. So remember, if your child has an itchy anus or vagina, or they complain of anal or vaginal pain, they feel hungry all the time, or lower abdominal pain, then you have to suspect worms as the most common cause. And so we usually advise hygiene is very important. Make sure they wash their hands when they come back from school. They wash their hands after every meal. Hygiene is very important because the most common reason why children get worms is what we call the oral fecal route of transmission, which means anything they touch with their hands, then they go and pick up food with their hands, and then that goes into their mouth. And that's the most easiest way of catching worms, the oral fecal route of transmission. So if you have any further questions, please feel free to ask and subscribe to my channel.